Good afternoon. Thank you for giving me the opportunity to present here today. Here are some of our disclosures. Now, urine storage and emptying is a complex physiologic process that's under the control of the central nervous system. And the micturition pathway has previously been studied through various functional brain imaging studies. However, how brain activity changes as bladder volume and bladder sensations change remains unclear. Therefore, we aim to quantify cerebral perfusion and change in brain activity in healthy subjects during bladder filling. In our study, 8 healthy women without overactive bladder received functional MRIs as their bladders were being filled through a Foley catheter. Subjects were given a response button and instructed to indicate when they felt the first sensation of bladder filling, the first desire to void, and a strong desire to void. Scans were then performed at set bladder volume intervals listed here. And we looked specifically at 8 different regions of interest that were previously identified as having a role in the micturition pathway. Our results showed that at the first desire to void, there's increased cerebral blood flow seen in the insula and the right anterior cingulate cortex, but decreased cerebral blood flow seen in the supplemental motor cortex. At a strong desire to void, we saw a decreased cerebral blood flow in the insula, the right posterior cingulate cortex, and the left hippocampus. And if we look specifically at the right insula, we see that there's increased cerebral blood flow seen at lower bladder volumes and at the first desire to void, but decreased cerebral blood flow seen at a strong desire to void compared to the first desire to void. These results suggest that cerebral blood flow increases as the desire to void increases until we reach a critical point where it then decreases, potentially to suppress the desire to void. Now, all of the regions of interest that we looked at have been known to play a role in bladder filling and emptying. However, here we've just listed the regions of interest that had specific significant changes during bladder filling. We don't know what roles they might actually play during bladder filling, but some of their known roles are listed here. For example, the insula is known as the seat of visceral sensation. The hippocampus is involved in memory. The anterior and posterior cingulate cortices are both involved in emotional response, and the supplemental motor cortex is involved in the coordination of movement. In conclusion, our data suggests that cerebral blood flow increases as the desire to void increases until it reaches a critical point where it then decreases, potentially to suppress the desire to void. In addition, our data show that there are differences in regional brain perfusion that occur as the bladder fills and demonstrates that these differences can be objectively quantified, and these data may be used as a reference point in future studies investigating normal and abnormal bladder function. Thank you.
Thank you very much. This abstract has been considered for prize award as being best in category. Is there any question from the floor?
Yes, Matthias Walter from Vancouver, Canada. I have a couple of questions. One, first, what is the unit of the CBF you're using? Second, what kind of method did you use to quantify CBF? And what do you think is the difference, the advantage, disadvantages, compared to Bolt signal acquiring using FMI?
So as far as the units we're using these are all voxels. I'm not sure what you mean by what your second question was.
Well, usually cerebral blood flow is a velocity-dependent activity. You have a speed, not a voxel base,
okay,
because that would be the amount of perfused voxels.
Okay.
The second part would be, how do you quantify it? Is it a post-acquiring process? You're using MATLAB or anything else to method the CBF? And the other one is, what is the difference between CBF and your FMI technique compared to Bolt signal acquiring?
Yeah, actually, I was one of the investigators on the study. I can help answer some of those questions. So nanograms per milliliter is the answer to your first question. We actually use a technology called arterial spin labeling, which is different than, as you may know, from bold imaging. Bold imaging only really provides for a qualitative measure of cerebral blood flow. That is, what areas are increased in activity compared to decreased. ASL imaging allows us to quantify cerebral blood flow as opposed to just provide a qualitative measure.
Thank you very much.